All right, hey everyone. So I figured I would make just an additional resource here, a supplementary video, hopefully giving everyone a bit more clarity about the bones reviewed in class. So this is going to be a lot of repetition, but hopefully that repetition breeds, a better understanding of this content. So we'll get going. Similar to class, these are our objectives, skeletal segments, and we're going to be going over these bones specifically in a bit more detail. So starting with the skull, okay, specifically the skull cap. All right, our calvaria is this dome-like upper portion of the skull that is made up primarily of the frontal, parietal, and occipital bones. Now from this view, this is a superior view. We have our frontal bone, and then we have our two parietal bones. So we can say P number 1 and P number 2. That's parietal bone number 1, parietal bone number 2, and we can't really see it here, but the occipital bone would sit in this most posterior aspects, okay? We have two different sutures here. We have our coronal suture, which is going to separate us from an anterior perspective from posterior, okay? And then in addition to that, we have our sagittal suture here. Now just adjacent or just lateral to that sagittal suture are going to be your parietal foramen, okay? And this is oftentimes near the lambda, which we'll talk about in just a minute. All right, so when we talk about cranial fossae are at its core just three depressions in the floor of the cranial cavity, and they house and support different regions of the brain. So starting, we have a anterior cranial fossa, we have a middle cranial fossa, and finally we have a posterior cranial fossa. Now our anterior cranial fossa is formed primarily from the frontal bone, which I'm highlighting here, the ethmoid bone. Within it you have your crystal galli and your cribriform plate just lateral to it, the bone with, or I should say the area of the bone with all of these little features or holes in it. And then you finally have, as part of the anterior cranial fossa, the lesser wing of the sphenoid bone, okay, which, as we referenced in class, looks a little bit like a manta ray. The middle cranial fossa is shaped by the sphenoid bone and the greater wings with the sella turcica and the temporal petrous portion. So let's review that again. So the middle cranial fossa shaped by the sphenoid bone, which we have here. Okay, that's the border of the middle cranial fossa. We have the sella turcica in the middle here. And then we have the temporal portion of, the petrous portion of the temporal bone, which we see here. That is going to be the other border of the middle cranial fossa. So that's our petrous portion of the temporal bone. And if we remember back in the class, that petrous portion of the temporal bone is when we take this interior look at the skull, it's going to be that raised portion of the temporal bone. Our posterior cranial fossa is going to be formed, I would say, chiefly by the occipital bone with the foramen magnum and parts of the temporal bone as well. Okay, this is what houses the portions of the brainstem and the cerebellum, as we talked about in the nervous system lecture. Okay, and then finally, just to appreciate the borders here, as we talked about, the border between the anterior cranial fossa, this here, so anterior cranial fossa, with the middle cranial fossa is going to be the lesser wing of the sphenoid bone, okay? The border between the anterior cranial fossa and the middle cranial fossa is going to be the lesser wing of the sphenoid bone. This is different than what divides the posterior cranial fossa from the middle cranial fossa, and that's going to be the petrous ridge or the petrous portion of the temporal bone. Okay? So, if we keep looking at it from the superior point of view, we can identify a number of bones here. Now, starting with the anterior cranial fossa, we talked about how we have the frontal bone. Take that back. The frontal bone here, occupying most of the anterior cranial fossa. We have our ethmoid bone with our cribiform plate off laterally, and our cristogalli pointing up superiorly. Okay? We have the lesser wing of our sphenoid bone. And then in the lesser wing of the sphenoid bone, what we should be able to see is the optic canal, or the opening for the optic canal, which, as we referenced at least in the lecture, it's kind of the eyes of the manta ray. Make them a little happier. Now, if we go further into the middle cranial fossa, we find the rest of the sphenoid bone. Okay? The rest of the body of the sphenoid bone. We have our greater wings down here. So lesser wing up here, greater wing down here. We can see that from a lateral view of the skull. We'll talk about that a little later. We have our sella turcica, which is this area right here. We also call this the hypophyseal fossa because it houses the the pituitary gland. Now, we can't really see the foramen rotundum in this view, and part of the reason for that is the foramen rotundum is really going to sit under the lesser wing, or the anterior clinoid process. We call these the anterior clinoid process of the lesser wing. So if you can imagine, our foramen rotundum is just kind of in that area underlying the anterior clinoid process of the sphenoid bone. What we can see, though, is both our foramen ovale and foramen spinosum. Now, our foramen ovale, I want you to think about ovale meaning oval. So ovale equals oval. And that is going to be our oval-like projection there. Not projection, but fossa, rather. Now, that is our foramen ovale. And just inferior and lateral to the foramen ovale, you're going to find a small little foramen. You can actually color that in blue. And that's going to be your foramen spinosum. If we move from the foramen spinosum, medially, what we'll find is going to be the foramen lacerum. Okay? Moving on. If we go to the petrous part of the temporal bone, we have our anterior surface, and that's going to be the petrous portion of our temporal bone, that raised ridge. So if you're studying or using this video to study and you have a skull in your hand, if you look at the interior of the skull, it's going to be the raised bit. And then finally, we'll look into the posterior cranial fossa, and we have our occipital bone containing our foramen magnum, our hypoglossal canal, which is a little tough to see from this view. The way to find it is going to be the foramen just outside of the foramen magnum, okay? Or the canal just outside of the foramen magnum. And then finally, we have our groove for the sigmoid sinus. Something I didn't mention is also going to be the IAM, or internal acoustic meatus, and that is going to sit on that petrous portion of the temporal bone. And similarly, you should be able to find that on all of the skulls in class. So the external and internal laminae, these are all oftentimes referenced as tables. It's composed of a compact bone on the outer surface and a compact bone on the inner surface here. Outer surface, inner surface. Okay, and that's compact bone meant to enclose and protect the brain. Okay, the diplo or diplo, depending on how you pronounce it, is going to be much more of a spongy, cancellous, trabecular type bone, and that's going to be sandwiched in between the two tepals. Okay. Okay, so we'll start with our frontal bone, and that is what forms our forehead. Okay, so we have, in addition to the frontal bone or features on the frontal bone, we have our supraorbital foramen. Okay, we have foramen just outside, and then the thickened portion on the superior aspect of the orbits is going to be your supraorbital margin. Okay. Moving on to our nasal bones. Nasal bones are going to be small paired bones. It forms the upper bridge of your nose, and you should be able to palpate that on yourself. Our maxilla. Our maxilla contributes to the upper jaw, the infraorbital foramen here, pointing at it right now, infraorbital foramen. The alveolar process for our teeth, specifically the upper portion of our teeth. And the anterior hard palate, which you can't really see in this particular view, but does form that anterior portion of the hard palate. Moving on to our zygomatic bones. Zygomatic bones, we can see the outline of them here where my highlighter is. Okay, and our zygomatic bones are really going to form the prominence at our cheek and the lateral orbital rim. And this is what I mean by lateral orbital rim. Okay, on the lateral aspect of the orbit, helps form or give contour to the eye socket itself. Moving on to our mandible. That is going to be our inferior jaw. We have a horizontal body here. We have the mental foramen. We have our midline symphysis. And then from this view, kind of tough to see, but you should be able to see these two areas here. Yeah, but you can't really see the condylar process, which articulates to form the TMJ, but you can better see this is the condyloid process. Coronoid process. Apologies. Our condylar process is going to be superior. Which forms the TMJ, or articulates with the mandibular fossa in the temporal bone to form the TMJ. Okay, moving on. We have our lacrimal bone. A little, as I said before, a little tough to see, but it's going to be that kind of orange reddish on the medial orbital wall. Our ethmoid bone, going to be here. In our ethmoid bone, we're going to have a feature called the perpendicular plate. I'm highlighting right now. And that helps form the nasal septum along with the vomer bone, which is going to occupy the inferior portion. We can also point out our inferior and our middle nasal conchae. As I said before, from a frontal view, we can see the vomer. That's going to form that inferior portion of the nasal septum. These are our orbits, nasal cavities, nasal septum, our conchae. A little tough to see the hard palate from here, but it's going to be the undersurface of, undersurface of the maxilla here, forming or with the palatine bone. And then we have our superior orbital fissure. Okay, Our superior orbital fissure, if you can see where I'm outlining, is going to be that bony cleft between the lesser and the greater wings of the sphenoid, okay? So our superior orbital fissure is formed by the superior and inferior wings. Oh, excuse me, I shouldn't say superior and inferior. I should say greater and lesser wings of the sphenoid. Okay. So definitely not superior, inferior. Greater, lesser wings of the sphenoid. Okay, so if we look at it from an inferior view, look at some of the bones here. We have our maxilla, which is going to occupy most of the anterior space, but more importantly, it forms that anterior portion of the hard palate, whereas the palatine bone forms the posterior portion of the hard palate. So this is our maxilla. This is our palatine. Okay, this is anterior, this is posterior. All right, so maxilla is going to form the anterior portion of the hard palate. Palatine is going to form the posterior portion of the hard palate. Our vomer, which we can see right here, that's going to contribute to the posterior part of the nasal septum. We have our sphenoid bone, listed here in blue, or seen here in blue. And what we can see with the sphenoid is we can see that it has these structures called pterygoid plates. We can see we have a medial and a lateral pterygoid plate. So this would be one of our lateral pterygoid plates, and then our medial pterygoid plates. So those bony projections are going to be the pterygoid plates of the sphenoid bone. We have our greater wings that we talked about before. And then we have our foramen ovale. That's going to be our oval-like structure. And our foramen spinosum. Okay. If we wanted to go a little bit deeper into here, we could see that we also have our carotid canal and our jugular foramen. Okay? So other features to point out here is we have our temporal bone. Specifically, this is the mastoid process of the temporal bone. Oops, sorry, everyone. This is the mastoid process of the temporal bone and the styloid process. So that little bony projection, stylus-like. That would be our styloid process of the temporal bone. Now, in that region as well, we can see that we have both, meaning both on either side, we have something called a stylomastoid foramen, and that is going to be the foramen or hole between the mastoid process of the temporal bone and the styloid process of the temporal bone. Okay? Looking at the occipital bone, we have our occipital condyles. We have our external occipital protuberance. And we have our hypoglossal canal. Okay. So just to clarify so everyone's on the same page, what makes up the hard palate is going to be the combination of the maxilla and the palatine bone. So this is going to be our hard palate. Okay, and then just last thing to point out, just posterior to the hard palate, we have our choani. Okay, and our choani are going to be these bony openings bounded by the vomer, the palatine, and the sphenoid. Okay? So if we look at a lateral view here, we can start by looking at our parietal bones. It forms much of the lateral wall of the skull and roof of the skull as well. We can look at our temporal bone. And our temporal bone is going to have a couple different portions to it. Where I'm highlighting now is called the squamous portion of the temporal bone, which really helps form that lateral wall. Now, a couple different features of the temporal bone. We have our external acoustic meatus. We have our mastoid process from a lateral view. We have our styloid process from a lateral view. And then we have our mandibular fossa. Okay? This is what helps, or this is the articulation that creates the temporomandibular joint, or TMJ joint. We see the frontal bone here. Our frontal bone is going to contribute to the forehead and the superior orbital margin. We have our zygomatic bone, maxilla, mandible, and sphenoid bone. And specifically, this is the greater wing of the sphenoid bone. So the greater wing of the sphenoid bone is the only bone that is visible from a lateral view. We can also look at the structures in the lateral view that are not as well defined in other views, zygomatic arch being one of them. And we see the zygomatic arch here. And that zygomatic arch is the bony arch formed by the temporal process of the zygomatic bone, temporal process of the zygomatic bone, and then the zygomatic process of the temporal bone. Okay, so we have temporal process of zygomatic bone, and we have the zygomatic process of the temporal bone. We can also see here we have a temporal fossa, and that temporal fossa is going to be the shallow depression on the lateral skull, bounded by the temporal, the parietal, frontal, and sphenoid bones. All right, so if we go on, we can take a look at a posterior view. Now, starting with the occipital bone, and a couple features here to appreciate, one of which is going to be the external occipital protuberance. And from the external occipital protuberance, you have something called a superior and an inferior nuchal line. Okay, we didn't specifically go over those in class, but they will be referenced as we start getting into the musculoskeletal. Really, it's just talking about the muscles of the shoulder and the neck, as a number of muscles do attach to that area. From this view, we can also see our parietal bones, and then we can kind of see our temporal bones here with our mastoid process at its most inferior point. Now, from this view, we can also see we have different sutures, one of which is going to be our lambdoid suture. And the lambdoid suture is going to be between the occipital and the parietal bones. The lambdoid suture is between the occipital and the parietal bones. Okay? Let's see, what else? We're not going to go over the occipital mastoid suture. Yeah, I think from the posterior view, external occipital protuberance, mastoid process, and then you should be able to see the styloid process down here as well. Mastoid process, styloid process. This is why there was a pause there, is I want to go over the different sutures. So our lambdoid suture, as we talked about, is going to be between the occipital bones and the parietal bones. Our sagittal suture is going to be between the two parietal bones. Coronal suture, going to be between the frontal and the parietal bones. The squamous suture, and we call it squamous because this is the squamous portion of the temporal bone, the flat portion of the temporal bone. This is between the I would say, squamous portion of the temporal bone and the parietal bone, and we call that the squamous suture. We have something called the spheno-squamous suture, and it's between the squamous portion of the temporal bone and the greater wing of the sphenoid. And then finally, we have our sphenofrontal suture, which is between the frontal bone and the greater wing of the sphenoid bone. Okay? Frontal, parietal, temporal, sphenoid. Okay? Now you should be able to determine where this suture is by identifying or breaking down the word. Spheno meaning sphenoid, frontal meaning frontal. This is the suture that separates the frontal bone from the sphenoid. Okay, so we talk about the mandible. We can identify a couple different areas here, starting with the body of the mandible. The body of the mandible is going to be this horizontal portion forming the lower jaw and bearing the lower teeth. Okay. The ramus, on the other hand, is going to be the vertical projection on each side of the mandible. Okay, so your body is going to be your horizontal projection. Your ramus is going to be your your vertical expansion or extension. Your angle is going to create the contour of the lower mandible. Kind of forms the posterior corner of the jaw. Should be able to palpate it on yourself. The mental foramen on the anterior surface of the foramen. Your alveolar process, which holds the tooth. Your condylar process, and that's going to be our posterior superior projection. And this is the area that articulates with the temporal bone to form the temporomandibular joint. The head here is its articular surface, and the neck lies just below it. The head is that articular surface, the neck lies just below it. Moving anteriorly, we can see an anterior and superior projection of what we call the coronoid process. And this is one of the attachments for the temporalis muscle. Our lingula is going to be this small, almost tongue-shaped projection on the medial wall of the ramus, or the medial ramus, I guess you could call it. And this is kind of what guards the mandibular foramen or canal, which is right here. Okay. So the mandibular canal or mandibular foramen is this medial, or this opening on the medial ramus that helps to transmit nerves, or transmits nerves and vessels through the mandible. Okay, we talked about it before. What makes up the hard palate? This is an inferior view of, let's see, a bit more zoomed in on the hard palate. The hard palate is made up of the palatine bone and the maxilla. Choanae, vomer, tracing the outline of the vomer, and then you can kind of see them here, but we have our foramen ovale, and then our little tiny baby foramen spinosum there as well. So foramen ovale, foramen spinosum. The other thing to point out here would be your pterygoids. So we have our lateral pterygoid, our medial pterygoid, lateral pterygoid. I'll do that one more time. Lateral, medial, lateral. Okay? Okay. Hyoid, we have three areas. We have a lesser horn, a greater horn, and a body. That's all you got to know about the hyoid. Okay, so when we talk about a typical vertebrae, so a typical vertebrae is going to have generally all of these features, okay? And we're going to look at each of these in a little bit more detail. Starting with the body. So the body of the vertebrae is the anterior portion that takes most of the weight, okay? It's your most weight-bearing portion of the vertebrae itself, okay? And it's going to be always anterior, okay? Body of the vertebrae is always going to be anterior. The lamina, we see that here, is this posterior, almost bony plate here to here that forms the vertebral arch. We call this the vertebral arch. Okay, that's where the spinal cord runs through. So the lamina helps to form that vertebral arch between specifically the transverse process and the spinous process. So the lamina helps to connect those two areas. This is different from the pedicle, which is a bit shorter. It helps to connect the vertebral body to the transverse process. The pedicle connects the transverse process to the vertebral body. Our transverse processes are going to be the lateral projections. Our spinous process is going to be our most posterior projection. Our vertebral foramen is going to be this large central opening within a single vertebrae. Okay? Vertebral canal is a continuous passageway formed by stacked vertebral foramina. Okay? So we only find that vertebral canal when we stack vertebrae on top of one another. We have our superior and our inferior articular processes and facets. We don't see the articular facets in this particular picture, but we do see the processes. The difference between the two is the articular facets are the smooth articular surfaces that essentially form the synovial joints between the vertebrae. Okay. The intervertebral foramen is going to be the lateral openings, and that's formed by adjacent vertebrae stacked on top of one another. Okay? So we only see that intervertebral foramen when we have adjacent vertebrae sitting on top and below. Okay, so we can look at the cervical vertebrae, and we can look at some more of the specific areas in the cervical vertebrae. So just a couple things to point out. So the normal cervical vertebrae are often going to be bifid in nature, okay, or bifid in nature. All right, what that means is we see these two projections on the posterior aspects, specifically on that spinous process, okay? This is different. C7 is kind of unique. It starts looking a little bit more like a thoracic vertebrae. C7, it has a long and prominent spinous process. As we will talk about in the neck lecture, or the cervical lecture, we call this the vertebra prominence, okay? Because it is the most easily palpable area or most easily palpable vertebrae in the neck. You should be able, if you bend your neck all the way forward and you run your fingers down the spine, you should feel a pretty pronounced vertebra, and that's going to be vertebral C7, or vertebrae C7. All right, so just a couple unique features about C1, which we have here. Okay, we have anterior and posterior arches. So we have our anterior arch here and our posterior arch here. We have an anterior tubercle, little bony prominence, and a posterior tubercle. And then we have a superior articular facet, which we typically find in normal vertebrae, but what we don't find in normal vertebrae is we have a facet for the dens, okay? And the dens is going to be this tooth-like vertical projection that articulates with the atlas, okay? And this is what serves as the pivot for rotation in the spine. Okay. So more or less things are the same of a typical vertebrae in the thoracic vertebrae, but one thing I do want to point out here is that we have on thoracic vertebrae, we have costal facets on the vertebral bodies. And we see that at least, let's say this is the 6th thoracic vertebrae, we have a superior and an inferior costal facet, okay? Our typical thoracic vertebrae are going to have a costal facet on each side of the body. So we have on our normal, I would say typical thoracic vertebrae, and that's usually T1 to T9, we have 2 facets on each side of the body, a superior and an inferior. And this serves as the articulation with heads of two adjacent ribs. Okay? This is different from more of our non-typical thoracic vertebrae, T10, T11, T12. Usually they have a single costal facet. Okay? So our typical, when you think typical thoracic vertebrae, think T1 through T9. And then we have in T10, T11, T12, we generally have a single facet to articulate with the ribs. Now, in addition to our superior and our inferior costal facets, we also have costal facets on our transverse processes. Okay? And this allows for the articulation of the transverse process with the tubercles of the ribs. And we'll look at that in just a second here. Okay? Now, something to note is that T11 and T12 do not have facets on their transverse processes for articulation, all right? And it's really reflects the kind of free-floating nature of the ribs, okay? We see that here. We don't have a costal facet on a transverse process in T11, T12. We do have it in our ordinary or typical thoracic vertebrae. And our lumbar vertebrae, okay? This kind of has all of our normal features that we would typically see in a vertebrae. Something to note here is that we have large bodies of lumbar vertebrae, and that is one of its distinguishing features. It also does not have costal facets. Okay, moving on to the sacrum. The sacrum is composed of 5 fused vertebrae, okay? And it forms into this singular triangular bone, but know that 5 fused vertebrae form the sacrum. We have our anterior sacral foramina and our posterior sacral foramina, okay? We have our base, which is going to be what articulates with the body of L5. We have something called our sacral hiatus here. Take note of the sacral hiatus. It's going to be this inferior opening at the distal end of the sacral canal. Okay? Inferior opening at the distal end of the sacral canal. We have our auricular surface. This is what articulates with the ilium at the sacroiliac joint. This is one of the features that articulates with the ilium to form the sacroiliac joint or SI joint. And then finally, we have our promontory. All right, and our sacral promontory is this anterior edge projecting from the base of the sacrum. Okay, this serves as an important landmark on skeletal models in that it signifies the lumbosacral junction. So if I had a vertebra sitting on top of that, that vertebra would be L5 because my sacral promontory or my sacral base really articulates with the body of L5, but it's the sacral promontory which acts as that landmark to distinguish between the lumbar spine and the sacral spine. And we call that the lumbosacral junction. Okay, so the lumbosacral junction would be this over here. Our coccyx is going to be 4 vertebrae. And then moving on to the sternum, our manubrium is going to be this broad, flat, superior portion of the sternum, and that's what's going to articulate with the clavicles and the first ribs, okay? This is our manubrium here. Our body, I should say first rib, clavicle and first rib. The body is going to be this elongated central portion, and that articulates with the costal cartilage of ribs 2 through 7. Okay, we can see that here. This is our first costal cartilage, 1, 2, 3, 4, 5, 6, 7, articulating with those 7 or the costal cartilage of those 7 ribs. We have our xiphoid process here, our jugular notch. All right, this is the central depression at the manubrium, central portion of the manubrium, or superior border of the manubrium, you can call it. You have your clavicular notch. This is where our clavicles articulate, the medial ends of our clavicles. And then we have our sternal angle here. Okay, this is going to be this transverse or horizontal ridge at the junction of the manubrium and the body of the sternum. All right, so we look at ribs. We talked about costal cartilage, but this is going to be our costal cartilage here. All right, and it's our costal cartilage. It's this flexible band of hyaline cartilage, okay? Connects the ribs to the sternum. And what's interesting about this hyaline or this costal cartilage here is that it's more, I would say, elastic in nature, because it allows for the elasticity of the rib cage. Because you think, what is one of the purposes of the rib cage? It's absolutely protection, but it has to allow for inhalation and exhalation, which means accommodating for space changes or volume changes inside the thoracic cavity, right? Because of breathing at the lungs. Okay, so this is kind of elastic, or has a greater density of elasticity to it, or elastic fibers, than other areas. We have our true ribs that attach directly to the sternum via their own costal cartilage. We can say that here: 1, 2, 3, 4, 5, 6, 7. So that 7th rib is going to attach to the sternum via the costal cartilage. And then we have false ribs, which is 8 through 10. And they're false because they attach indirectly to the sternum via joining the cartilage of the rib above. I'll put it that way. So our false ribs, which are 8 through 10, they're ribs that attach indirectly to the sternum via the costal cartilage above. Okay, so we go 1, 2, 3, 4, 5, 6, 7. That's our 7th rib attaching the costal cartilage directly to the sternum. 8, 9, 10. 8, 9, 10 are going to be our false ribs, and they attach via the costal cartilage of the rib above. And then finally, we have our floating ribs. They're down here. You can see it, our 12th rib and our 11th rib. 11, 12 are going to be classified as our floating ribs, and they do not attach to the sternum, okay? They end in the posterior wall. Okay, so our angle is going to be the point or the greatest curvature, the point of greatest curvature of a rib. It's where it bends forward here. The tubercle is going to be a small prominence on the posterior surface of a rib, and this is the area that articulates with the transverse process of its corresponding vertebra. Okay, so you can go back to the thoracic vertebra and see that articular facet on the transverse process. That's what articulates. It's the costal tubercle, which articulates with the articular surface, or the costal surface on the transverse process. The neck is going to be right distal to that of the head, which is going to be right here. That's where we articulate. And we can see here, this is the costal facet of the transverse process articulating with the costal tubercle of the rib to form this anterior projection, forming into the costal cartilage, attaching to the sternum. We're going to take a closer look at the upper extremity. So if we look at the clavicle, we have our sternal end, and we have our acromial end. Okay, our sternal end is going to be our medial end, and it's going to be a bit more knob-like, a bit more enlarged. And this is the area that articulates with the manubrium of the sternum to form the sternoclavicular joint. So it's this sternal end which forms our sternoclavicular joint. Okay. This is compared to our acromial end. That's going to be our lateral, and it's going to be a bit more flat. Okay. And this is what articulates with the acromion at the scapula to form our acromioclavicular joint. Okay? And then the last thing I want to point out here is our conoid tubercle. Okay? And this is going to be our small bony prominence on the inferior portion of the clavicle near its acromial end. So anytime you find that conoid tubercle, you know you're closer to that acromial end. And it's that conoid tubercle which serves as the attachment for the conoid ligament, which is a support structure for the acromioclavicular joint, okay? But part of the corticoclavicular ligament. This is one half of the corticoclavicular ligament, the other one being your trapezoid ligament. So our scapula, a number of different areas here. We have our medial border, we have our lateral border, superior angle, inferior angle. We have the glenoid. That's where the head of the humerus is going to sit. We have our coracoid process, which is going to be our anterior projection, serve as a site of attachment for a number of muscles. We have our acromion, which articulates with the clavicle to form the AC joint. If we look in the posterior aspect, we see our spine of the scapula, and then our feeds into our acromion. Okay? Now, separating, or what separates, or the areas superior and inferior to that of the spine of the scapula is going to be our suprascapular fossa or supraspinous fossa, and then our infraspinous fossa. Okay, this is where our supraspinatus muscle originates, where our infraspinatus muscle originates. Specific to areas on the glenoid, we have a infraglenoid tubercle and a supraglenoid tubercle. Long head of the biceps attaches to the supraglenoid tubercle, and then our triceps, long head, triceps attaches to that infraglenoid tubercle. And we'll get into that, but know the bones and know that for right now. We'll get into the muscles a little bit later. Okay, looking at areas of the humerus. Okay, so the humerus, we can start off with our head. Okay, our head is going to be that smooth, rounded, proximal end of the humerus, and that's what's going to articulate with the glenoid cavity of the scapula. Now, right below the head is where we have our anatomic neck. Okay, and it's that anatomic neck. It's this little groove, or this narrow groove, that exists immediately distal to the head, okay? And this is where the joint cavity of our glenohumeral joint attaches to, okay? And this is different from our surgical neck, which we can see here. Our surgical neck is going to be inferior, and especially inferior to that of your tuberosities. So that's our surgical neck through here, okay? Common area for fracture. Common area for humeral fracture, I'll specify. We have most anteriorly, we have our lesser tubercle, and then off laterally a bit, we have our greater tubercle, okay? Now the space in between that is going to be our intertubercular sulcus or intertubercular groove. Okay, you hear this known as, or also referenced as, the bicipital groove. Okay, we have certain muscle attachments both at the lesser tubercle. Supraspinatus is going to attach there, and then the rest of our rotator cuff muscles are going to attach onto that greater tubercle. Moving down, we can see our deltoid tuberosity here. And our deltoid tuberosity, it's going to be this rougher area on the lateral shaft of the humerus, and when we get deltoid attachment in that area. We can see our medial and our lateral epicondyles. Appreciate how the medial epicondyle is a bit more pointed. We have forearm muscles that attach to this area. We have our capitulum and our trochlea. Our capitulum is going to be much more round-like on the lateral distal humerus, and this is what articulates with the head of the humerus. Head of the radius, excuse me. This articulates with the head of the radius. Our trochlea, on the other hand, is going to be on the medial surface of the distal humerus, and this is what articulates with the trochlea notch of the ulna, and we'll be going over the ulna in just a bit. Okay, we found our olecranon fossa on the posterior aspects of the humerus, and our coronoid fossa on the anterior aspects of the humerus. Okay, and then finally here, something to note is we have our radial fossa, and that's going to be a shallow depression just above the capitulum, and that receives the lateral, it receives the head of the radius during elbow flexion, So the radial fossa is going to be just superior to that of the capitulum, and it's going to serve as the depression where the head of the radius moves to during elbow flexion. So the head here, it's this disc-like or disc-shaped proximal portion of the radius, and it articulates with that capitulum of the humerus. The neck is going to be right below that, just distal to the head of the radius. We have a radial tuberosity here. Okay, this is going to be a roughened prominence, medial proximal radius. We have our styloid process. This should be relatively easy to palpate on yourself. Okay, this is going to be a pointed projection, lateral aspect of the arm or forearm in anatomical position. And then finally, we have the dorsal tubercle or Lister's tubercle, and this is going to be the small bony protuberance on the posterior distal radius. So moving on, we have our olecranon process. Our olecranon process large proximal projection of the ulna that forms the bony tip of the elbow. Once again, easily palpated. This is where our tricep muscle attaches. We have our coronoid process, which is going to be this anterior projection, anterior and medial projection. So we can see an anterior view here. It's this little lip on the anterior surface of the ulna. And then we have this medial projection as well, also considered to be the coronoid process. Our ulnar tuberosity. Ulnar tuberosity is going to be this roughened area, and it's just distal to that of the coronoid process. We have muscle attachment here. Our radial notch. This is going to be a shallow depression, lateral ulna that articulates with the head of the radius. And then finally, what I want you to know is we have this little styloid process of the ulna, and it's going to be that pointed projection at the distal end of the ulna to assist in stabilization of the wrist joint. All right, so now we get into everything hand related. So everyone develops their own little mnemonics. I would encourage you to either look it up or develop one of your own. But that's the mnemonic I've always used, or the order of the mnemonic I've always used. It stands for scaphoid, lunate, triquetrum, pisiform, trapezoid, trapezium, trapezoid, capitate, hamate. All right, we can see that here. We have our scaphoid, lunate. We have our triquetrum, trapezium, trapezoid, capitate, hamate. All right, what's missing here? Well, we don't have a pisiform here because we can only see that from that, I would say, palmar view, because of that anterior view. The pisiform is a sesamoid bone, so it sits within the tendon of the flexor carpi ulnaris, okay? But we have, once again, our scaphoid, our lunate, our triquetrum, our trapezium, trapezoid, capitate, hamate. We'll go on the other side. We have our scaphoid, we have our lunate, triquetrum. The pisiform is going to sit on top of the triquetrum. We have our trapezium, trapezoid, capitate, hamate, with a particular feature here called the hook of the hamate. So metacarpals, numbers 1 through 5.